Now to the pandemic. As much as we'd love to stop reporting on COVID-19, the virus is still with us, but there are some encouraging signs about the spread of the novel coronavirus in Canada. The latest federal data shows overall cases are on the decline. There's a stark picture, though, of where the virus is persisting. Over the last 2 weeks, 90% of all new cases in Canada were in Ontario and Quebec. In particular, the cities of Toronto and Montreal have become hotspots for transmission. Other provinces have seen a drop in infections. Canada's public health officer warns that does not mean now is the time for anyone to ease up on physical distancing.
These models all tell us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility.
The latest federal projections predict that by June 15th, the death toll from COVID-19 in Canada could reach 9,400 people. At this point, more than 7,600 people have died. More than 600 new infections were confirmed today. The vast majority of them are in Ontario and Quebec. A number of other provinces recorded no new infections today. New Brunswick recorded its first death related to COVID-19 today, and it's connected to a doctor who did not self-isolate after returning from Quebec. An 80-year-old man living at this long-term care home near Campbellton has died of COVID-19. The home is dealing with an outbreak after a staff member who is in contact with that doctor working at the Campbellton Regional Hospital tested positive. There are 14 active cases in New Brunswick now, all of them in the Campbellton area. A major study that cast doubt on the safety of using hydroxychloroquine to treat COVID-19 patients and halted global trials of the drug has now been retracted. 3 of its authors say data used to produce the findings could not be independently verified. Heather Yourex-West explains.
When the Lancet published a study in late May linking hydroxychloroquine with an increased risk of death for COVID-19 patients, scientists around the world took notice.
It caused people to stop doing what they're doing in terms of high-quality science and to pause, to delay the high-quality science in order to try to sort out whether this initial paper was accurate or inaccurate.
The observational study was the largest on the subject to date, but now 3 of the study's authors say the patient data compiled by Surgisphere Corporation could not be independently verified. We deeply apologize to you, the editors, and the journal readership for any embarrassment or inconvenience that this may have caused.
It's really unfortunate for science.
Dr. Michael Hill is the co-lead of the Alberta Hope Trial, a hydroxychloroquine study that was suspended because of the research published in the Lancet.
Our safety committee has reviewed everything and said that, look, the trial looks totally safe and there's no adverse effects with, major adverse effects with hydroxychloroquine.
But the delay has been costly for the study. In the time since the Alberta research was suspended, COVID-19 cases in that province have dropped. Researchers aren't sure if the Alberta Hope trial will resume at all. On Wednesday, the World Health Organization announced its international clinical trial on the drug had been cleared to resume. The demand for fast science has led to an unprecedented amount of collaboration among scientists worldwide. But accuracy isn't something that can be sacrificed.
There has to be some evidence of transparency and learning from this so that mistakes like this aren't made in the future.
Because the stakes at this point are high, with both public health and public trust on the line. Heather Yourex-West, Global News, Calgary.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the New Reality. A Global News special, Sundays at 7 on Global.